Good morning, Uganda, 5 minutes past 8 a.m. You're watching UBC TV. Welcome to the GMU Agenda. My name is Philomena Masco. And of course, as always, we do have quite some interesting conversations during this hours to educate ourselves, to get to know what's happening around us, what's happening to those close to us. And we are always encouraging you to be part of our conversations. As always, continue letting us know, sharing your opinions, your thoughts, your questions. While you're seeking clarity, well, make use of our WhatsApp platform, 0709 602 592. And go ahead and make use of Twitter. The hashtag is UBCGMU. Well, this morning, our conversation, we are going to be taking it straight to a special category of people in our society. They are like us, just with some disabilities here and there. But today, we'll be talking more about that. Now, who am I talking about? We are going to be looking at the autistic community here in Uganda. When you hear the word autism, what do you understand? How would you explain it? How would you interpret that as an ordinary Ugandan? It's no wonder that we'll be having this discussion, autism acceptance and awareness. We're expounding more about an autism mind and brain. And in studio this morning, I'm very lucky to have two people who are quite passionate about that. And I do believe they are the best people that we could have this morning to create for us a clear picture and also educate us, me and you. Well, I am very lucky to be joined by one Dr. Francesca, a child neurologist and also pediatrician from Massachusetts General Hospital and Harvard Medical School. Doctor, thank you so much for joining us.
Thank you for having me.
Very, very happy to have you here. And I do have Pamela Kakonge Titi from Tunaweza Children's Center. Of course, even before we get into the details, she'll be telling us more about the center and what relationship does it have when it comes to autism or even dealing with people with autism. Thank you so much, Pamela, for coming this morning.
Thank you for having me here today.
Very, very happy to have you. And if you have any questions about autism, like I did say at the start, we have to be educating ourselves, and we could take this opportunity to do that. Any clarity, anything you want to know more about this, please go ahead. Our WhatsApp number is open. I should be getting your questions, your thoughts, your opinions, and I'll be sharing it with our guest this morning. Like I did say, just for more clarity, 0709 602 592 is the WhatsApp number, and Twitter hashtag UBCGMU. I'll definitely be seeing all your questions and I will be forwarding them straight up. Well, starting off with autism, and I'm going to start with you, Dr. Francesca. Autism, what is autism?
Yes, autism is a neurodevelopmental condition that we understand as a spectrum. So we call it autism spectrum disorder. It comprises challenges with social interaction and communication, but it often also comprises restrictive and repetitive behaviors. All of those two signs and symptoms, they can present on a spectrum, with some patients being milder and other patients being more severely affected.
Okay. Well, Pamela, you come from Tunaweza Children's Center, and we are talking about autism. Maybe even before we get into the details, just tell us more about the relationship between the center and autism, being as the topic of discussion this morning.
All right, so Tunaweza Children's Center is a center for children with special needs. We don't only work with children with autism, but we work with children with special needs, ranging from mild disabilities to their severe cognitive issues. So this center was formed after I realized that we do not have enough, or if any, therapists to take care or help parents manage children with special needs and disability. Okay. So I decided to start that. I started it because I had a child who had brain damage, and it was very, very difficult to get help here in Uganda. So, and when we were starting, I had a few therapists, but I still went ahead and got some doctors and therapists from the United States, Massachusetts in particular, where my daughter was born, and I had created a connection. I am not a doctor, I am a mother, and I don't think there is a better therapist than a mother. So the center was then formed. When it was formed, it came with a purpose to give a chance to a child with special needs to have a normal life.
Yes.
So normal life, I mean like reach their full potential. It doesn't mean that if you have a child with a condition like autism, cerebral palsy, Down syndrome, these children are not are supposed to be hidden away and kept away from society. So we decided to come up with this center, offer services that will help these children achieve their full potential and be able to contribute their quota to society. This means that if a child has got brain damage, this child should be kept away. No, 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 no. This child can get therapy, get better, and have a meaningful life. They are talented, they have special talents in them, they have the ability to be like any other child,
yes,
but with a special need that when addressed, they get better. So that's what the center advocates for. So among the many things we are looking at as a center this week is autism, because this is the Autism Awareness and Acceptance Week, where we're going to talk about how best we can help these children reach their full potential. So that's what Tunaweza does, and it's located in Chiwatle, plot 121, and it is a center that offers a curriculum that will help these children reach their full potential. So we have physiotherapy, occupational therapy, speech and language therapy, special education, music and art therapy, and all this, in a way, contributes in the interventions to help the child reach her full or his full potential.
Okay. Now, as we go on with this discussion, Dr. Francesca, I mean, we'll come to realization that we still have a lot of a gap when it comes to knowledge, when it comes to diagnosis, especially to somebody who is not in the medical fraternity, especially people who deal with these issues. Maybe you could take us through the diagnosis of autism. How do I know? I mean, even outside of being a medical personnel, how do I know that my child could actually be autistic?
Exactly. So there are quite clear signs that you can detect and that give you some clues into whether a child may have autism. You do not need necessarily a standard diagnostic test to suspect that there is autism. One common finding is that there is the child has challenges making eye contact. The child often struggles with language development. The child struggles with making connections with other peers, other children. So often there is no interactive play, or there is limited interactive play. They struggle taking, putting themselves into other people's shoes. So some of that, we call it theory of mind. And taking perspective is challenging for patients with autism. Other very quite clear clues into whether a child could have autism are stereotypic behaviors, and those could present as, for example, repetitive hand flapping, sensory stimulation, that is unusual and repetitive. So these are all clinical, basically symptom cues that may cue you into whether the child may have autism. Regarding the second question, there are standard diagnostic screening tests and diagnostic tests, and actually diagnostic criteria that have been published by the autism and the developmental neurology community. One of those criteria is written down in the DSM-5 manual, which is a diagnostic manual. The challenge is the formal diagnosis of autism requires professional training, and this is what we are trying to achieve, to train professionals here to be able to make a diagnosis of autism, to increase the number of children, increase the diagnosis of children with autism in order to get them to therapies. And we know that there's a significant socioeconomic impact if autism remains underdiagnosed and untreated.
Okay. Well, we're looking at autism acceptance this morning, and we are, opening ourselves up to new information. And I'm already actually getting a couple of questions, as I did really ask people to come through. Well, we'll be getting into a lot of things, building capacity here in Uganda to ensure we cater to, the autistic community, and also creating more awareness. We'll be looking at the challenges, even the myths, which is quite very interesting. Like we were having a prior conversation, there are very many myths that are being shared in our communities when it comes to autism. But Pamela, could you take us through some of the challenges right now that are being faced, especially by these autistic people? One thing I know for sure, that there is a lot of stigma, a lot of stigma in our socio communities and setups. So maybe you could build on that, and very many other challenges that we're not in the know of.
Okay, so we have quite a number of challenges, and like you have said, the most common challenge is the stigma. These kids, because of their behavior, reactions, and their developmental delays, parents don't quite know yet how to help them. So they take a lot of time hiding these kids from the public with the mentality of like, my child has bad manners, my child is not this kind. And yet, actually, that shouldn't be the point. This child has a neurological disorder which can be treated through therapy, and you're able to solve the problem. So one of the challenges is stigma, and this stigma does not only affect the parent, it also affects the child and affects everybody in the family around, and even in the community. So if we can do away with stigma, then our children can be able to reach a certain level. Apart from stigma, stigma is both negative and positive. There's the stigma where the child is brought into the community and everyone is shunning the child. There's the stigma where the parents don't even bring the child into the community. The child is kept at home. So this is one thing. But I think all this is caused by one major thing, which is lack of information and lack of knowledge about autism. Autism is not the end of the world. These children are talented. These children can be somebody. These children, if treated early enough, can be someone. We have so many success stories where we have been able to see a child go through therapy at an early stage, which is the early intervention programs we have, let's say, at Tunaweza and maybe other places, and these children still go on and become somebody. We know so many people on the spectrum in the international spheres who have autism. So if we have enough information, which we are trying to create like right now, and parents are taught and shown that these children are normal, they just have a disorder, they can actually live a better life and their families can be better. So if there's enough information, I'm sure we would curb the stigma.
Yes.
The second biggest challenge is that we actually don't have resources to manage these children. For instance, the therapy centers are few that have therapists. Yes, there are many homes you hear about, homes for children with special needs, but are these children actually getting the treatment? No. Why? Because we don't have enough therapists. And even when we have the few that we have, we don't have enough knowledge. Like she's talking about the diagnosis, very few people are trained in the diagnostic ways of getting to know that this child has autism. And it's not only for autism, but other conditions in this sphere. So if we could have enough resources, and how can we create these resources is by training more people who would understand how to manage these children. Secondly, resources. It's so expensive to manage a child on the spectrum. They have different diets that they depend on. You need different equipment, like for instance, a child with sensory issues who has sound issues.
Yes.
You'll find all the time they are doing this and, it's being affected. So you will need the headphones, those devices they use to manage that sound reflection. There are some who have sensory issues of the body. So even the equipment to do this therapy is not available. So all those resources, it comes down to the fact that we don't have these resources and we don't have enough staff that can manage this. Most children on the spectrum have communication issues. So we need speech therapists. We have very few in the country. And even with the story of inclusion, these kids must be in schools. These schools are not trained to manage these children. So that also makes it very difficult. So when we have information about the condition and then we have the resources, then we are sure that the parents will be able to manage this. Another challenge that we have is that the parents and are not on the same page.
Yes.
So you'll find a father is, we have to do therapy. A mother is, that's not going to help me. Let's have another baby. This baby is a write-off, or the other way around.
Yes.
The father is saying we're going to have another child. This child cannot be of anything. And all that comes back anyway to lack of knowledge, but also the cost of treatment is quite high. And most families can't afford this. So of course, that brings in a lot of disconnect in families and in communities, and it's such a big challenge. So if we have these resources, I think we can also curb on the cost of treatment for children with autism, because autism is a lifelong condition.
Yes.
And I think those three are the major challenges. And when I talk of lack of resources, I mean even finances, I mean even trained staff, I mean even facilities, like schools that actually have it.
Yes.
I know there are many schools and many who have children with autism and many homes, but do they actually have what it takes to educate these children? Our systems are not supportive, the education system. We don't have curriculums that are specifically made for those people. And it is something that the government, I'm sure, is working on, and even us who are in this sphere are trying to do, but we're still behind. And those are like the major challenges. So if we have the information and the resources, I'm sure children with autism would reach their fullest potential.
Well, you speak of school, Pamela, and it actually reminds me when we were having results being released for primary living PLE. And one of the biggest reasons when we're looking at the performance review, looking at children with special needs, the performance was still wanting. And one of the reasons that was given is that, and especially amongst the groups, we did have the autistic people talking about how some of the resources in these schools don't exactly favor them. And it's no wonder we're seeing a performance like they had. So when you talk about some of these necessities, especially when it comes to the education system, there is still quite a lot that we need to incorporate to be able to cater to the children with special needs. Well, Doctor, we've seen the challenges, but I also love for you to create for us a picture and even let us know some of the myths that are exactly connected. I'm sure you've had some of the most bizarre things about autistic people when it comes to treatment, when it comes to diagnosis, and even how society perceives the autistic people.
Yes. So starting about some of the common autism misconceptions is that one of the main causes that people think are associated with autism is that the mother somehow gives it to the child, and we know that this is not the case. So autism is a multifactorial condition. We know, based off extensive research, that there are both genetic, familial factors playing into the development of autism in a child. There are neurologic factors, so how the brain develops, how the neurocircuitry develops, how the areas of emotional reciprocity, language processing, and executive functioning, so all different areas of cognitive functioning, how they communicate in the brain of a child with autism. And we know that there's a third factor, which is environmental factors, which we also don't just fully understand yet. So autism is multifactorial. There is no one cause, which makes it challenging to find a cure. Okay. Yes. Now, how does this relate into myths? So the common misconception that it comes from one parent, common misconception that autism results from not enough affection and lack of love from the mother. So it's, again, there's a lot of shame on the maternal side, which is not correct. Another frequent misconception is that autism, there's thought to be, there are a lot of culturally diverse beliefs.
Yes.
And what I know is, for example, for Uganda specific, is that there may be families who wonder if there are bad spirits involved. And we just don't have any evidence that this is the case. But you know, being culturally sensitive, I think we have no research evidence that supports those points.
Okay. All right. Pamela, any myths that we've had from our very local communities here?
Some of the myths are those. Some say they were bewitched. When we are doing assessments and you're sitting down with a parent and going through the assessment and say, so tell us about the child. I said, you know, my child used to speak and she was okay. Then when we went to the grandmother's home, we came back and the I think the grandmother must have done something. They don't like my son or something like that. And you know, autism is prevalent in boys than it is in girls. So it comes with this thing of like, because I gave birth to the musika, you know, I gave birth to the hair, so some people are not happy for me, and so they could have bewitched me because they believe that he didn't have autism at birth. Yes. So it must have come at the age of 6, 7. That is not true. Autism has not been diagnosed early enough. So by the time the child is of school-going age, 6, and he's in class and he's not relating with his age mates, you find that that they start saying that is when the autism came. Yes. That is when he caught the autism, and it was after that long holiday he spent in the village.
At the grandma's.
At the grandma's. And yet the reason maybe is that they did not identify this condition early enough. So early identification leads to early intervention, which helps inclusion very easy. Yeah. So if you identify, and what are these things you should know? First of all, look at the eye contact. Is this eye contact okay? Second, is this child behaving normally? Does he socialize with other kids? Yes. Is he able to talk at the age of 2? Have you really looked at the developmental stages? Has this child achieved this before you conclude that he caught autism at the age of 6? So that is one myth. The other that is common lately is that there is actual cure of this, like there's actual cure. Some have done a few transplants, and I will leave the doctor to talk about the medical bit, but that is one myth, that there is a cure, so you go somewhere and do this and the baby gets better. I don't know if that is true, and that is why I think the doctor will clarify on that myth. Definitely. But the main thing I think that is very common is that my child got autism at a certain age. No. It can't come. You can't be normal to 6 and then start catching autism at 7, 8, stage. 9. No.
Oh, okay.
Yes, and it's not witchcraft.
Absolutely, we are rolling out witchcraft. It's not causing any autism. Please be aware. Nobody should lie to you about witchcraft and its contribution to this disability. I do have a couple of questions, and there is a viewer here who is asking, and she wants to hear from the doctor. Can children with autism outgrow it and become normal later in life as well? Now, this is actually opposite to what we're saying, those that can actually catch it later. People who think they get it later. So this one asks, do they outgrow it?
Yes, very good question as well. So we know autism is a lifelong condition. Children do not outgrow autism, but what we can do is, with our therapies, we help children with autism manage the behaviors, learn the skills that they have challenges acquiring, and with that they show improvement and they are able to function very well in society. So autism is a lifelong condition, but there are ways to manage and ways to help and support children and families with autism.
Yes, just to complement what the doctor was saying is they don't outgrow it. But when you have treatment at early stage, which is intervention, which is therapy, you will like 90% outgrow or achieve the goals that you set out to achieve. For instance, if you have speech therapy, you'll be able to speak. You have not outgrown the condition, but because of therapy, you are able to communicate. You may not actually speak, but you can communicate. And the point comes down to early intervention. Early identification is early intervention, and eventually you'll be fine, But it doesn't mean that you have 100% cured from it.
Okay.
But yes, children on the spectrum are very talented. So if you concentrate on that talent and develop it, get out of the behavior issues, manage your sleeping pattern, get out of diapers and use the bathroom normally, all those are through training, and you achieve that.
Okay.
But you will have the lifelong condition with you.
Okay.
Yes.
I can say more about therapies and what we know
Yes,
about the
please.
therapies that
Yes,
have evidence. So there are a lot of research studies into therapies that suggest cure. For example, stem cell therapy approaches or certain supplements. Unfortunately, there are very few studies that look into those substances and agents, and for stem cell therapy, there is just not enough evidence that we have to support, first, that it is safe, second, that it benefits the patient, and third, that patients have a long-term benefit, not just for the first 3 months or 6 months after the intervention, but we need patients to show improvement longer term, right? Yes. Lifelong. They need to achieve life skills, they need to function in society. And the currently only proven therapy that has a lot of data that shows that patients get better is called ABA, or Applied Behavior Analysis. Yes. And this is an approach that targets all these specific behaviors, the language and communication issues, and addresses them specifically through what we call positive reinforcement, breaking down the behaviors that need readjustment, that need learning, and repeating with positive reinforcement, and that over time gives those patients the skills to succeed in life.
Okay. And of course, now as we get into what we are doing here in Uganda, I think it's also very important to understand, now that you've, as a parent, you recognize that you have an autistic child, what is the future of this child? Because usually, like you did put, like Pamela did put among the challenges, some parents, the moment they realize that their child is autistic, they outrightly just cancel them out. But what is the future? You've come to realize that my child is autistic. What's going to be the future anyway after that? Are there opportunities for them? I mean, what would you tell a parent who has an autistic child right now?
A child with autism may not necessarily have a similar future path plan like a neurotypical child. Yes. So the neurotypical children, these ones who go to primary 1, P2, go on to P7, sit exams, pass, go to university, become doctors. A child with autism may not necessarily go through that, but can go through one thing that he so likes. We have children at the center who have gone to schools and concentrated on 2 things. One, in home economics. This child leaves the center, like after, she likes being organized, because children on the spectrum are extremely articulate with whatever they choose to do. So she's so neat, she's so organized, she goes to school, so she becomes a leader within school. Yes. So if you see that this child is a leader, you work on that, and these children will be leaders. We know so many leaders who have come up and through the center, yes, and have gone to other schools and become head boys and gone on. They are doing just what they know how to do. And this particular child went to, I think, ISU, and he does cookery, like culinary arts. Yes. He knows how to go to a supermarket, buy what he needs to do, come back, prepare a meal, you know, that kind of thing. So if you work with that, only that, this child will be a very great chef. Yes. Yes. We've had some other child who did mainly home economics. So in their home right now, he's the one who takes care of home management. He wakes up in the morning, makes sure the list of shopping is done. He goes to the market, buys them, brings them home. He's a home manager. So if we had facilities like hospitality, this is a child who would be transferred into the hospitality maybe company, yes, and do housekeeping in a hotel or something, and so if you know what their strength is, you work on their strength, and there will be somebody. And there will be somebody. My child doesn't have autism. She is a special child, but she wants to be a teacher. She's working so hard, yes, to be a teacher. She has not studied biology, social sciences, and whatever. No, she just did English, and she continued doing her therapy within the school, and did mathematics, and did child development, and she's concentrating on child development. I am 95% sure that she's going to be a great teacher.
Yes,
yeah,
indeed.
because that is the area she has chosen to take. And we don't have to bombard these children with mathematics, literacy 1, literacy 2, geography, history. Choose what the child does best.
Yes.
Work on that, and you will see a very big difference.
Okay.
And we have seen many, just that we somehow they are not mentioned, but we've seen quite a number.
Yes,
Yes.
actually in a very own Ugandan setting.
Yes.
There is a question here, Doctor. There is a concerned parent who is asking, what's the clear cut between autism and ADHD? That is, I think, attention deficit and hyperactivity disorder.
Yeah.
So they want to know the difference between those two.
So both are different, autism spectrum disorder and ADHD or ADD, so attention deficit hyperactivity disorder or attention deficit disorder. But they can go along together. So there are patients who are on the spectrum who do not have signs of attention deficit or hyperactivity. So for those, we do not make a concomitant diagnosis of ADHD. But there are some patients with autism who also have ADHD, and those patients actually benefit from therapy or management medications, ADHD medications. I personally have, there are several patients in my practice who are on the autism spectrum and who also have significant behavior issues because they have an ADHD component. So they have they are extremely distractible. They have challenges focusing on the ABA therapy, the OT, PT, SLP. So just getting these patients to focus on the therapy is extremely challenging, which limits the therapy outcome, right? So those patients I started on medication that is a standard management for ADHD, and they did so much better, and they made leaps and bounds in their therapy effectiveness. So both conditions are separate, but ADHD can be associated with autism spectrum disorder, and it's important to recognize that because it opens up an additional treatment opportunity.
Okay. She also asks, and I don't know, Pamela, if you can answer this, why can a child with ADHD get help in Uganda? Now, if you could probably, if you have an answer to that, and also maybe just open into or building capacity here in Uganda, what are you doing currently as the center? Yes, as the center.
So at the center, we do the ABA therapy, which is occupational therapy, physiotherapy, speech and language, and of course we have aquatherapy, music and art. So that's the ABAB therapy, where they will come in and do therapy. So if they have the component of the hyperactive disorder, we always refer them to neurologists who will prescribe the ADHD maybe medication, and this is really a doctor to determine whether he needs that. The center does not treat with their prescriptions. We do therapy just. So where would she go? I think she would still come to Tunaweza, because even when you get that treatment, you still need the therapy. And I think the therapy is the basic of all this. So you might find even through the therapy we do, there are some calming effects. I know 2 or 3 at my center who are calmed down by aqua therapy. So when they go in for swimming lessons, they are calmer, easier to manage, and it has improved their concentration levels and music and art. Yeah, so those are the 2 areas that you have to look at. If we feel this child is on the ADHD high hypertension, then we send them to the teacher. And if they are on the low bit, I don't know, they are not hyperactive and they need stimulation, we still have therapy in occupational therapy that could stimulate them and bring them up. So I think Tunaweza will still offer a better option.
All right.
Yes.
Well, there you go. And finally, as we're coming close to this, creating awareness. How are we doing and what are you doing? Probably this could be coming in from both of you,
yes.
Dr. Francesca and Pamela. I'll sit with you, Pamela.
Okay. So this week is an Acceptance Week and Awareness Week. We will have a conference at Chambogo starting tomorrow and it ends on Friday, 8 to 5 o'clock, but tomorrow it will be 8 to 1 o'clock. This conference is going to have more like an awareness and a training, and I think Doctor will speak more into
yes.
that. But the main reason of the conference is to bring together parents, therapists, and other professionals and teachers who are working with children with special needs to learn more about autism, explain it in detail, how the mind works, how the brain works, and the transitioning into adulthood. And mainly to give hope to people that these children actually can reach their full potential and can contribute to the society and can be included in the society. So we will have this conference running for 2 days, and we have sent out quite a number of surveys, and we have asked them to ask us questions in advance, and we'll be addressing all these questions during the conference. The conference is taking place at Chambogo. It will be at the Central Lecture Building block, which will be room 105. On Thursday, it will run from 8 to 1 p.m. and then on Friday it will run the whole day. Okay. Yes.
All right.
And the doctor can maybe add on to, because she'll be one of the main key presenters.
Okay.
Yes.
Please, Doctor.
Yes. So the first part of the Awareness Week is educating and talking about autism in more detail regarding diagnosis, treatment, management, associated conditions, as we mentioned before. From a doctor's and a scientist's perspective, I think the long-term goal is part of autism awareness leading into education, leading into empowerment of people, families, professionals here, is understanding the numbers of autism. So a long-term goal will also be to know what is actually the prevalence of autism in Uganda in order to assess the numbers and the need, which then informs us about how many therapists are needed and how much more work needs to be done.
Okay. Thank you so much, Dr. Francesca. Well, the ultimate goal here is to get ourselves informed, to know information, to get information, to make sure that we cater to the autistic community. There is nothing absolutely wrong with them. They have a disorder, yes, but you don't have to stigmatize them. They're human beings and they deserve equal opportunities just like a normal person. So go ahead, get this information as you should, and please come and attend this conference. It definitely would be handy. Eddie, what do I need to come and attend the conference? Is it free?
It's free.
Yes, absolutely free.
Absolutely.
Okay. Well, thank you so much, Dr. Francesca. For stopping by and giving us this info. Pamela, thank you so much. It's been a pleasure having you two wonderful ladies share this knowledge. I will leave it at that. We do have sports highlights coming in with Ruben just a couple minutes from now, and later on Chira will be coming in with GMU Extra. Allow me to wish you a wonderful Wednesday. I will see you tomorrow. I am Philomena Masco. Good morning, Uganda.
Live from Now Avenue in UBC Studios. This is Good Morning Uganda.